Hi, everybody. Welcome to today's Research America Alliance discussion. And thank you so much for joining on Zoom today and for your partnership in the Research America Alliance. Today, we're very excited to be joined by the recipients of the 2023 Gordon and Llura Gund Leadership Award, Heywood Fralin and Dr. Michael Friedlander. Before we get started, we have a brief 2-minute video we'd like to show you that highlights the work of our honorees.
Thank you for joining us in recognizing Research America's 2023 Advocacy Awards honorees. Our awards honor those who have made extraordinary contributions to the progress of medical and health research. It is my pleasure to introduce Mr. Heywood Fralin and Dr. Michael Friedlander, recipients of the 2023 Gordon and Llura Gund Leadership Award. This award recognizes individuals who have made significant contributions to increasing the level of advocacy for medical and health research at the local, state, or national level. Mr. Fralin and Dr. Friedlander have worked together to establish the Fralin Biomedical Research Institute at the Virginia Tech Carilion School of Medicine. They've also recruited world-class biomedically focused research teams and built partnerships to expand research opportunities and investment across Virginia.
Well, I'd like to congratulate Mike Friedlander and Heywood Fralin for this honor. I couldn't imagine a better pair to be recognized, and their impact on biomedical research in Virginia, but certainly globally as well. Congratulations, Mike. Congratulations, Heywood. You're a dream team, and I'm glad you're being recognized for your exceptional contributions to Virginia Tech, to research in the U.S., and to its global impact.
This institution started 12 years ago and one employee, Mike Friedlander, and today they have 39 research teams, spectacular research teams, over 500 employees, and become one of the major economic development engines in this region.
It'd be fair to say that I am indeed proud of the success that we've been able to make in a relatively short period of time, really over about a decade. The Research Institute enterprise here has launched itself into national prominence. And so I'm very proud of the people that are part of this operation, the organization, and the impact and effect it's had.
It's very clear to me, researching your backgrounds, that this is most well-deserved. And I congratulate you and thank you for the work you've been funding and supporting.
Research and all of the efforts associated with research generate high-paying jobs. And the only way that you can really increase the economic opportunities in the community is to develop more high-paying jobs.
I think it's really important to have advocates for science at all levels of the career trajectory, not only the more senior established folks, but those all along that career path. I'm a firm believer that the sort of research we do is not only important for our peers and colleagues and share with each other, but to be able to talk about it effectively to those who support it and everybody in the community, because ultimately it's their science, their research, and their help.
We are very excited to be honoring Dr. Friedlander and Mr. Fralin, and thank you both so much for your efforts in pursuit of health and medical progress. And I'm now going to turn it over to Don Jeffries, who's the Director of Visual Strategy at Virginia Tech, who will be moderating today's discussion. Thanks so much for joining us. And Don, I'm handing it over to you.
Thank you, Sheila. I appreciate that. Good afternoon, everyone, and welcome, Dr. Friedlander, Mr. Fralin. It's good to see you. Today we want to talk about your innovative partnership at the Fralin Biomedical Research Institute at Virginia Tech. And I wanted to start at the beginning, if we can. Can you give us a little background on your collaboration and how this all started?
Sure, I'd be glad to start and have Heywood join in. Well, it really started in a serious way about 15 years ago when the leadership of Virginia Tech, a public state university, R1 research intensive university, and Fralin Clinic, the major health system in this part of the Commonwealth of Virginia, the Southwest. The leadership got together at time Dr. Ed Murphy, who was the CEO of Fralin Clinic, and then President Charles Steger was then the president of Virginia Tech, came together to say, look, this region really needs not only increased medical education and having a new medical school under an entirely new model, very research intensive, where all the medical students do research, but also a major independent research enterprise, which became eventually the Fralin Biomedical Research Institute, operating in parallel with the medical school and in close collaboration with our Fralin Clinic colleagues. So that's how it all started, between that leadership and that vision, that dream that they had has grown now over a decade or 12 years, when it was really founded in 2010. And the medical school has gotten off to a fantastic start. Again, with every medical student deeply involved in research, doing great things that go on to outstanding competitive residency placements for the medical students. And then the Research Institute growing, as you heard, some of the numbers to about 40 or so research teams now and several hundred investigators, with a grant portfolio over about $160 million, which started at zero 12 years ago, and a lot of really fantastic students, fellows, faculty, and staff that's taken off. And I think if both Dr. Murphy and Dr. Steger were able to be here today, they would be very proud to see their dream and vision becoming reality. Heywood?
Yeah, I was much later involved in the effort. I became interested because of the economic opportunity for the region, and knew very little about the research that was going to take place or was taking place at the time I became involved. Over the years, though, as I became more involved, I began to understand just how wonderful the research was and what the quality of it was. And now I'm sort of like a kid at a candy store when I come down to the Research Institute, because there's a new candy being sold, and it certainly is exciting. So it's been terrific. And if there's one word that I would use to emphasize what's happening here, it's the quality of the research. It is making a difference in the region and a huge difference in the world as well.
Yeah, maybe Don, I just add one thing to that I meant to say. I talked about the initial leadership that formed a partnership you asked about, but one of the really important things that I've seen grow is the continuity of that vision and leadership. So I mentioned those two founding members from Virginia Tech, Fralin Clinic have passed on, actually. And then the presidency of Tim Sands at Virginia Tech, and then Nancy Agee, the CEO of Fralin Clinic. They have completely bought into this vision and not only continued it, but helped grow it, invested in it, and so forth. So that continuity of vision, of leadership of two major institutions is such an important part of getting something like this launched and making sure it continues to be successful.
Yeah, absolutely. And that sort of leads me to my next question, because, you said not only has this become a reality, but the Fralin Biomedical Research Institute has really become extremely productive in a really short period of time. Can you talk about that a bit?
Sure. Now that's very true. I've worked throughout my career at several major academic medical centers. I've been around really great people, great places, great leadership. And so I have the luxury of having seen some very successful enterprises, and have tried to capture as best I could, with the support of the leadership here, how to embody that sort of spirit, starting from the ground up. So one of the things we did early on is we knew we had to assemble teams that were including not only early career investigators just starting out, but really identify some very established senior teams that would be willing, frankly, to take a chance and come to a whole new enterprise. We had this beautiful structure, these brand new buildings, but they were quite empty. And we were starting this enterprise in Roanoke, which is a wonderful city, But most people, when they think of Virginia Tech, think of Blacksburg, Virginia, which is about a 45-minute drive from where we are, which is the main Virginia Tech campus. And then Carilion Clinic, a really fantastic healthcare organization, very well known and increasingly known around the country, but originally more so in the Commonwealth. So we had to get the attention of established investigators. And we did that several ways. Number one is we got people that were really entrepreneurial in their own vision of how to grow research enterprises, that were willing to be part of something that was set up a little differently. We didn't have traditional departmental structures. It's a very interdisciplinary institute. And through that, we could attract some really fantastic investigators. So from that, we built on some of the early people that chose to come here and be part of this as a startup. And also, it's been, I think, easier over the years now to attract more teams, both at the senior and junior level. Also, the support from the community here has been fantastic. This is the best town and gown relationship I've ever seen in an academic medical center in my experience.
You know, something that's really unique about this collaboration is the inclusion of philanthropy. Can you tell us how that came about and why?
Well, I think I'll turn this to Heywood, because he's certainly been very much in that area and philanthropy. But I'll simply say that through the connections of Virginia Tech to the community, to their alumni, et cetera, there's been a lot of effort there. And then, you know, the business community and the leadership here, exemplified best by Heywood Fralin, I think have really addressed that issue. So I would like to have Heywood address that, if you might.
Well, as I said before, I became interested because of the economic development, and what I envisioned is certainly there are evidences that it's becoming true. As an example, the average salary in this region is about $44,000. The last I looked at it, and the average salary at the Research Institute is over $90,000. So that's evidence of very high paying jobs in this region. And it is making a difference. It is creating a number of startup companies coming out of the research. And to give you an example of just how good they are, there is interest in J-Labs and mentoring some of the startup companies. That doesn't happen by accident. It happens because of the quality of the research. The partnerships are evidence of the quality of the research. The Research Institute occupies a floor of Children's National Hospital. And that, again, doesn't happen by accident. It happens because of the quality of the research here.
You just named a number of benefits, and I'm wondering if you can talk about perhaps some other ways that this model is so valuable and how it affects the research that's taking place, the research at hand.
Yeah, let me speak to that a little bit. So I briefly mentioned the model that we have. So it's a research institute. So just to be clear, Virginia Tech has 7 or 8 research institutes. That's a model the university has had for quite a while. They're organized in 2 different ways. One are called thematic research institutes. So for example, we have one organized around national security, one around transportation. Ours is obviously organized around biomedical research. And then we have another type of institute called investment institutes that make investments throughout the university in areas to bring people together. But anyway, that model was well in place and established at Virginia Tech. So we had the luxury of building on a tradition of success of interdisciplinary research institutes. The nimbleness and the flexibility that imparts and that Virginia Tech imparts, again, is unparalleled in my observations, both at other institutions I've been able to work at and many institutions I've visited. And that is, instead of having the traditional silos, our model does not have those departments. For example, we might have a department of biochemistry, neuroscience, genetics, et cetera. We don't have that within the Research Institute. We are organized around thematic areas, around certain types of cancer research, cardiovascular research, brain research, child health, et cetera. And in any one area, we've been able to recruit and assemble teams that include a real mix of types of experiences and backgrounds. We have, of course, life scientists, we have chemists, we have physicists, computer scientists, engineers, economists, et cetera, psychologists working together to solve problems and create research grants and portfolios around that. So what that does is enable a nimbleness and a flexibility for how information and people move between groups that has really helped us be very successful in the grant domain. But more important than that is really in terms of the science, the creativity, the cross-disciplinary research. We've had people that are structural biologists that work on the shapes of molecules, for example, create collaborations with people who are behavioral scientists to attack problems, just really spanning across many areas. And I think in that, we have a tremendous model for really exemplifying and supporting creativity, letting the really entrepreneurial creative juices flow. And as Heywood mentioned, we have a number of spin-off companies now. So while all of our researchers are very much embedded in the traditional academic medicine enterprise, they're doing research, competing for grants, publishing papers, training students that, do all those things. In addition, a subset of them are commercializing their IP and starting up companies and taking that work out of the lab and getting it into the community. Of course, that has potential economic impact, but I think even more importantly, at least for me as an academic, is it allows our investigators to see their work come out of just the publications that we read, the scientists, and get out into the real world and affect people's lives. And that really energizes people, particularly our young faculty, students, and postdocs. They love being part of that translational enterprise.
Yeah, I'd like to make a comment here, Mike. One of the key components of the model is the medical school, which was created with research embedded from day one in the curriculum of the medical school. And the results have been spectacular. There are, it's still small, 49 incoming students, and they're looking to double the size. And hopefully the General Assembly in Virginia will go along with that recommendation, and I think they will. But for those 49 slots, they have 7,000 applications. They offer 100, but they make 100 offers, and they get 49 students out of those 100 offers year to year, and that's pretty spectacular. That speaks to the success of the model.
Yeah, I was.
Oh, sorry.
Go ahead.
I was just going to amplify a little bit what Heywood said. Absolutely. The medical students here, this is, I don't know if I call it unique being the only one, but it's one of the few medical schools in the United States that has such a research intensive component for all the students. This isn't just the student who chooses to do an MD, PhD, or a long-term project. Every medical student over all 4 years of medical school here, for the MD degree now, not the MD PhD, is involved in research, hypothesis-driven research. They have a mentor. They present their work at national, international meetings. They submit publication quality manuscripts. They're evaluated by a group of PhDs and MDs and various people with expertise in their area. And so we like to say we're training scientist physicians. We all know the term physician scientist. That's usually your dual degreed MD PhD as a physician scientist. So these students are getting an MD. They have a medical degree. They want to be practitioners of medicine, but they're scientist physicians. They learn from day one in medical school to bring the scientific method to everything they do in their diagnosis and their care of patients, in addition to the more humanistic qualities, but also to engage in research. Whether they run a lab or not, they can be in private practice, but they're comfortable reading the literature, engaging with researchers, et cetera. So in that respect, it really is a fantastic medical school and something different from most models around the country right now.
And, I was going to give you an opportunity to brag a little bit, and I will. I just wanted to see if you could share some other successes of the Institute so far.
Well, there really are many, to be honest, and it's fun to be able to brag, and I don't take credit for this. It's all these fantastic people that we have here, our faculty, our students, and our staff. I'll highlight one just that's fresh off the presses in the last 12 hours or so. One of our early career assistant professors, Dr. Sora Shen, did a study. She was very interested in understand how early life events, particularly traumatic events that can lead to PTSD, can affect our brain long-term and change other aspects of our behavior. Particularly, she's interested in eating disorders. So she did a study that was published yesterday in a journal called Nature Neuroscience, a very high-impact journal, where she looked at the effects in rearing laboratory animals, mice in this respect, that have an early traumatic experience being separated from their mom. and how that affects binge eating later in life. It turns out it triggers binge eating. And the way it does it, she found out mechanistically, is to reorganize a functional circuit in the brain, in the hypothalamus of the brain, that affects a certain pathway that uses the signaling molecule leptin. I'm getting into probably more details than anybody wants to know. But nonetheless, this is a fundamental discovery in the lab, but the potential implications for clinical practice and how people from psychiatry and behavioral health, internal medicine might be able to deal with this really are fantastic. Another area is we have a very high impact program in child neurorehabilitation for children who have had strokes. And so most people don't appreciate, we all know strokes, of course, can occur in us as we get older, which they're more typical then, but young children have strokes too at quite a high incidence. That includes in utero, children prior to birth having a stroke at time of parturition or soon thereafter during the postnatal period. Now, the good news is the child's brain is extremely resilient and plastic. In many cases, they're able to adapt and there really isn't serious long-term consequence, but in some of them there is. And the effects can be dramatic, like cerebral palsy, where there's damage to a part of the brain that controls certain part of the body. It used to be that physicians basically told people you get a little physical therapy, but there's not much we can do for that child. Thank goodness for the researchers we have here, led by Dr. Sharon Ramey, Dr. Stephanie DeLuca, and their teams, and they have large NIH grants to be one of the nation's leading pediatric neurorehabilitation centers here. They developed an intervention to work with kids to rehabilitate that damaged part of the brain with very intensive therapies, and they can get somewhere between 70 and 85% recovery in those children's brains. And they've studied many of them longitudinally, and I can think of a few incredible examples where kids have come back here years later who were told they couldn't do much with that part of their body and are now playing tennis, swimming competitively in college. I mean, doing fantastic things. So just a couple examples from, very basic laboratory work right up into interventions to help people in a clinical setting that I think have really set the stage for the work going on here and got us on the national radar, deservedly so, for these fantastic faculty, students, and staff that we have.
And Mike, I'm not as reluctant as you are to brag about what's happening here. I'm pretty well pleased with what's happening, and just a couple of statistics. Since its inception, the acceptance rate for applications for grants from NIH have run 32%, and this year I believe they're 36%, and over the last 5 years, which is a measure of increases that NIH keeps, the research funding here has increased 60% over the last 5 years. So I think those are pretty spectacular numbers.
Yeah, I appreciate you saying that, Heywood. And I can't help but think, getting the money is always important. We can't do the research without the money. And luckily for us, we have really terrific people who their colleagues at peer review think highly of them. But ultimately, it's the work that comes out of it. I was given a couple examples. And I can't help but not mention another example. We have a great program in brain research and neuroscience. We have investigators led by Reed Montague, who have come up with the first in the world way to measure in patients in the living human brain the release of neurochemicals that are very important for neuropsychiatric disorders: dopamine, serotonin, norepinephrine. And they're doing that work in collaboration with neurosurgeons, both here at Carilion, Children's National, and other colleagues around the country in New York, at Mount Sinai, in Arizona, at the Barrow Institute, et cetera. So that sort of work is very innovative technologically, and what it might be able to do to help folks is tremendous. It's also being done with kids in epilepsy monitoring units where you can measure these chemicals in their brain. And so that's going to open up all kinds of areas. Another major stride that's been made is one of our senior investigators, Dr. Rob Gordy, who runs our cardiovascular group, has come up with a way to deliver therapeutics in the body through these little vesicles called exosomes that he extracts from milk, non-pasteurized milk. And they're being used now in a series of trials to treat everything from heart attacks to wound healing and injury, radiation injury to the body. And again, Rob is one of those very entrepreneurial faculty who spun out a company around that, the Tiny Cargo company that's developing this. And then, the list goes on: addiction research and Dr. Bickle, the work that he's doing to intervene on behalf of people with alcohol use disorder and change the trajectory of their lives by the interventions they've developed. It's extremely gratifying and satisfying to see not only this really innovative scientific work, but how it's already impacting people's lives.
Yeah, Dr. Friedlander, I'm curious if you can give your perspective, how do you see an approach like this impacting research in the future? Any lessons learned?
Yes, I think there are several. One I'll highlight, I touched on it, and I'll try to amplify a little bit. I think by creating organizational structures, we have this research institute. I'm not saying it's the only way to do it. There could be other units at other academic health centers, but that really break down barriers and get away from our being locked into traditional disciplines only. I think it speaks to the ability to take fundamental discovery, move it through translational pipeline, and apply it. I mean, at our research institute, we have the investigators doing the very fundamental work in the lab on developing some of the technologies I just talked about, translating those, going into trials, working with our veterinary medicine folks, for example, to help with some therapies to treat patients who are pets in some cases, and then moving into human work in the clinics, and then taking that out and commercializing them. So everything you can do to eliminate barriers for those collaborations, in my opinion, is a plus. We have worked very hard at the Fralin Biomedical Research Institute to come up with ways to make sure our researchers can concentrate on their science. We have incredibly important and helpful administrative and technical staff so that our researchers aren't worrying about issues of getting visas for postdoctoral fellows and hiring people, tracking their grants and all the financial aspects, the IT support. We have invested heavily in all those services for our PIs, and we have created ways to remove any barriers between them collaborating between students, postdocs, individual labs using core facilities. And you can see what comes out of that. I just gave a few highlights. So I think any sort of models that allow for barrier reduction and facilitate through investment in pilots and facilities and support personnel to make it easier for people to work together across the translational spectrum, doesn't compromise in any way, in my opinion, the fundamental basic science. That's at the heart of everything we do. I'm a basic scientist. I believe firmly, as does the NIH, in fundamental discovery. But you don't have to compromise that by having the translational aspects and even right up to the commercialization part. And it does become a virtuous cycle. And I think we've been able to realize that here. And I would recommend others either embrace our model or come up with something similar whenever possible.
Yeah, Mike, I would also add to that the model using the research in the medical school. I think more institutions need to look at that. I think that's well worth investigating by a lot of others.
Absolutely. Getting the medical students involved. They're thinking about patients already in medical school from day one, and they want to be able to do things that'll have an impact there. And so they're particularly motivated researchers when they come into our labs, and they work with teams of graduate students, faculty, postdocs, but having the medical students involved deeply in research at a very deep and longitudinal level is an important part of the model, very much so.
Before I get to asking some questions from our audience, I wanted to ask you if you could highlight one thing that other organizations could learn from your model, from your approach. Would that be it, what you both just mentioned, or is there?
I think so. I'll try to be more succinct. Provide resources, identify great people, and get out of their way. So that's how I try to summarize what I tried to say in the preceding 7 minutes.
All right. Well, as I open up, I see my little chat thing lighting up. As I open that, I just wanted to ask you if you can tell our audience a little bit. I've been fortunate enough to be in that space in the lab to see some of the great work that takes place. But can you talk about where you are? That's not just a Zoom background. That's a real place where people are quite busy.
Yeah, Heywood and I are sitting right in our brand new facility. We're in the cardiovascular wing, or what we call the Center for Vascular and Heart Research at the Fralin Biomedical Research Institute in our newest building. So as we said earlier, the original Fralin Biomedical Research Institute and the Virginia Tech Carilion School of Medicine opened their doors in 2010. And we were in what then was a brand new building, is now 12 years old, which is immediately adjacent to the building we're in now and connected by a beautiful glassed-in bridge. And then a couple of years ago, with tremendous support from the state of Virginia and also Virginia Tech and Carilion Clinic, we were able to design and build and open this brand new research building. The pandemic slowed us down a little bit a couple of years ago, but by this last year, we got going full speed. We're only about 20% occupied in this building, What you're looking at in this cardiovascular area is now fully occupied. This particular area has 4 teams of researchers. We have 4 additional teams of cardiovascular researchers in the original building, so 8 altogether in our cardiovascular sciences. But it also has areas for things we call biomaterials and body device interfaces, a very engineering centric part. It has a ground floor with our veterinary medicine, oncology research, and clinical care. We have Virginia Tech's College of Veterinary Medicine patients, dogs and cats, who need treatment for cancer coming here to get state-of-the-art treatment, and they participate in clinical trials and they collaborate with us. We have all kinds of core facilities, including MRIs, MR-guided focus ultrasound, high magnetic field imaging, micro PET CT, molecular biology, et cetera, throughout the building. So this is a phenomenal facility that gives us the opportunity not only to grow, but to have great support infrastructure to help us attract and retain additional researchers as we grow the Fralin Biomedical Research Institute.
Mike, they may also be interested in what you did for the Commonwealth of Virginia for COVID testing.
Oh, thank you for bringing that up, Heywood. Yeah, we're very proud of that. When the pandemic hit, I guess about 3 years ago or so now, there were a number of our researchers here at Fralin Biomedical Research Institute. One I want to highlight in particular, Dr. Carla Finkelstein, who's a leading breast cancer researcher, but who decided we needed to really improve on the tests for COVID, particularly on the PCR test that came out of CDC initially. So Carla and her team got together, a bunch of postdocs, graduate students, faculty, dropped everything they were doing, came up with our own tests, diagnostic tests, went to the FDA, worked with the state health department, and we took a wing of this brand new building that it literally wasn't open yet, and it was designated for our infectious disease research teams to recruit new people, and turned it into a molecular diagnostics lab. That molecular diagnostics lab has now turned out better than 250,000 PCR tests. We're also doing whole genome sequencing to develop tests to isolate the variants and report to the state health department. And I'm very proud we've done that for Southwest Virginia, for the health department, for all of Virginia Tech. And even during the height of the pandemic, when we were doing 2,000 tests a day, we were reporting out our data every night, same day, when many other commercial facilities couldn't keep up and were taking days to got a test. And then Carla and her team developed a rapid mutational analysis here, single amplicon, to be able to determine the variant immediately within a matter of hours and inform the health department with actionable information. If you remember back when there were certain variants were around at the same time, and some of the treatments, the MAB, monoclonal antibody treatments and so forth, might be helpful for one and not the other. So the actionable information was, what variant does my patient have? And I need that information now. So we're very proud that the Fralin Biomedical Research Institute stepped up. Virginia Tech was phenomenally supportive financially to let us do that. Eventually, the state was able to come online and help us financially to run that facility. So that was just the way we pivoted, and we're able to be nimble and help the people of the Commonwealth.
Yeah, one of our questions came in was asking how the pandemic affected the Institute. And that was certainly a tremendous benefit for the community and the state, really, what you all were able to do. Were there any other impacts that COVID or challenges that COVID presented for the work that takes place there?
Yeah, it certainly did, as it did for many of our colleagues all around the country, all around the world for that matter. So, depending on which research program at the Fralin Biomedical Research Institute you're talking about, some of them we work with patients and human subjects. So the whole issue of contact, and many of them, you heard me talk about children who've had strokes, have families and children involved. So obviously we had to be extremely careful. We had to shut down a lot of those for a while, not bringing in people to have direct contact with the researchers and so forth. We eventually went to, very careful situations with masks and vaccination policies and that sort of thing. We also had to change a lot of our lab work over to shifts for a while. So you didn't have a high density of researchers in any one lab at any time. So you had some people coming in early in the morning, others later in the afternoon and the evening. That was pretty taxing for people with families, kids in school, daycare. And so we worked around that as best we could. It did slow down a lot of people. We had hired a number of new researchers during that period. We're just starting their labs. We're just putting in their first grant applications, and it slowed things down. So it took a toll, but I'm extremely proud to say Virginia Tech was phenomenally supportive for us to stay open. We never closed down completely at all. We put in place these various policies to let us keep going, and people have done exceedingly well. They've continued to get grants, publish their papers, do research. So it slowed us down a bit, but we had in place the facilities, the support, and the programs to keep things going throughout. And now we're really back full steam ahead.
Another question that's being asked, and you touched on the veterinary college and pet and oncology research, as well as Carla Finkelstein. You mentioned her breast cancer research, and this question is about cancer research and what takes place there. Can you dive into what's actually happening with pets and potentially breast cancer research?
Yeah, I'm very, very excited to share that with you. I won't restrict it just to breast cancer because that's not a big issue going from humans to pets, but there are other cancers that are more so. So, for example, we developed a few years ago at Virginia Tech something called the Cancer Research Alliance. We don't have a formal comprehensive cancer center like a lot of our colleagues at very established large medical centers, been around for a while. We haven't reached that point yet, but what I found was when I got here and some of the recruitments we were doing, we had a number of really outstanding cancer researchers sort of scattered around the university. Several of them on the main campus in Blacksburg in our College of Engineering, the College of Veterinary Medicine, the College of Science, College of Agriculture. There are a couple here, a couple there. And here at the Fralin Biomedical Research Institute, we were hiring several. So what we really need to do was have a cohesive program. We developed something initially called the Cancer Research Alliance. That includes now about 35 to 40 cancer researchers in their labs across the campus that we have, meetings and symposia, ways to fund things together. So we've developed a community first. We've gone way beyond that, though. You mentioned veterinary medicine, and I can't help to really talk about that because it's a wonderful program. Not every academic medical center in the United States has a veterinary medicine program. I think there are about 27 or 28 vet schools. I'm not sure the exact number. There are maybe about 150 allopathic medical schools and academic medical centers in the United States. So we have the good fortune at Virginia Tech not only to have a strong College of Veterinary Medicine, but to have the research part of that, particularly in the oncology space here. So they're actually located physically here at the Fralin Biomedical Research Institute on the ground floor of the very building we're sitting on now. And so just to emphasize to people, the pets that come in, these are not lab animals, mice. They're not being, sacrificed for research. These are patients. They're getting top quality care from our veterinarians. And they get, at a minimum, the standard of care, but then they may be part of a clinical trial and getting some new exciting opportunity for their care and treatment for their cancer. One of the interesting things is a lot of our pets get the exact same cancers that we do. One of them, for example, is this very deadly form of brain cancer, glioblastoma multiforme. So dogs get this spontaneously. And think about it. Our dogs, I don't know about you, my dog lives in my house, jumps in my bed, eats my food, goes on my lawn. We experience a lot of the same environmental factors, for example. And so they get that same cancer. As it turns out, the GBM or glioblastoma multiforme that dogs get spontaneously is molecularly identical to the pediatric form in humans. And in kids, often these brain tumors turn out to be deep and midline. And so they're very difficult to get to for surgical resection, for example. So we need new ways. So we're learning from the treatments we're developing with our veterinary friends. And, the regulatory burden with veterinary medicine is a bit lower than it is with human medicine. You can move more quickly into clinical trials. The costs are less. The time in the pipeline is less. So we have a wonderful shared program. You heard about Children's National Hospital in Washington, D.C., particularly on brain cancer research. We have investigators up there. We just had a great meeting today where our investigators and theirs that are working to deliver new therapeutics to children who have these brain tumors will build off the preclinical work we're doing here in the labs and with our veterinarians as well, using some of the technologies like, for example, focused ultrasound to open the blood-brain barrier to deliver therapeutics in children, as well as in the animals here. So, and there are a number of other cancers, osteosarcoma, there are a variety of other cancers that dogs share with us and cats. So this is a great opportunity for us to integrate veterinary medicine, human medicine, laboratory medicine research into one program. And around cancer is an area we're really doing that in a large way.
Great, thank you. Mr. Fralin, this question is for you. What do you envision the Research Institute's long-term impact will be on the surrounding community? For example, what will Roanoke look like in 20, 30 years as a result of the Fralin Biomedical Research Institute?
Well, in my opinion, the best is yet to come. There's no reason that this cannot grow into a major academic health center. And if that happens, I can easily envision a community that today is in the 250 to 300,000 population to become somewhere in the range of 1.5 to 2 million people if this institute continues to grow at the rate it's been growing. And I have every reason to expect that it will.
Great. And there are a couple of questions related to students studying at the Research Institute. Are there other health science students like public health, nursing, dentistry, and also are there students that aren't medical students?
Yeah.
There.
So we have lots of different types of students and learners across the spectrum here at the Fralin Biomedical Research Institute. So I've already mentioned the medical students in the research intensive medical school that work here, of course. We have graduate students from 11 graduate programs at Virginia Tech working at Fralin Biomedical Research Institute. We developed our own new graduate program about, I want to say it was about 8 years ago now. I may be a little off on the date, called TBMH, stands for Translational Biology, Medicine, and Health. It's a new innovative program. It won a lot of recognition. It won an award from the Association of American Medical Colleges as an innovative graduate program. We won a major NIH grant called a BEST Award. We were one of the first 7 institutions in the United States to get that award, to integrate our students and postdoctoral fellows to learn about various careers, not only in the academy, but outside in industry and so forth. Anyway, so that's a major graduate program that is headquartered here. But in addition, 10 other graduate programs headquartered on the main Virginia Tech campus. The students from those programs can work with us here and do. And that again goes back to what was asked earlier about one of the strengths. So we have this great partnership with the medical school, with Carilion Clinic right here in the Academic Health Center in Roanoke. But we also have very tight relationships with a number of other colleges on the main Virginia Tech campus. We just mentioned the College of Veterinary Medicine, College of Engineering, College of Science, College of Agriculture and Life Sciences. The list goes on, and College of Liberal Arts and Human Studies. And so all of those colleges, our faculty here at Fralin Biomedical, we have appointments in those colleges as well as at the medical school. And that gives us access to the students, graduate and undergraduate students, and it gives us access to collaborations with the fantastic faculty in those colleges that go way beyond what you'd find in a traditional health science center only. Once you get into computer science and engineering and physics and the behavioral sciences, et cetera. And I think that's, again, one of our strengths. In addition, we have a lot of high school students that work here from local high schools doing research. We have undergraduates majoring in a number of the pre-health sciences. We have a new undergraduate program, total immersion, where the undergraduates from Tech spend most of their time here taking their classes that are interested in either going into maybe medical school or veterinary school or research degrees. The other areas you mentioned were allied health sciences. So we don't have those programs at Virginia Tech, but our partner, Carilion Clinic, also has a very strong partnership with another university called Radford University. And Radford University Carilion have on this campus here students studying to be physicians assistants, nurses, PTs, OTs, et cetera. So more and more we're seeing interaction between our undergraduate, our graduate students, our medical students, and students coming in from the more the related allied health sciences as well. So we really see this growing up in a very broad way across learning. You asked about public health. We have a fantastic program for our veterinary school called Population Health Sciences. So we actually have our public health faculty and students and MPH program through the College of Veterinary Medicine at Virginia Tech, which is a little unusual, but it's actually provided great connections to the sort of things we talked about earlier in terms of the veterinary space as well.
We have just about 2 minutes left, but I wanted to see if I can get in a couple more questions. I know the city of Roanoke has been super supportive of this from the beginning, but one person is asking what role, if any, the city government or governance of the Commonwealth have played in making this successful and helping you make this successful, or if any of it has held you back.
No, I think the city's been very supportive, and this area that we are now located in used to be a junkyard and a feed mill where livestock feed was stored. It was a very industrial area and not a very attractive part of the city of Roanoke. And so the city's been involved in totally transforming this to a very, very desirable area, and has been quite supportive, and I'm confident they'll continue to be supportive in the future. And it's not just the city of Roanoke, it's Roanoke County and Montgomery County, town of Blacksburg, the whole region has been very supportive.
Sure.
Yeah, and I would second that. As I said before, in terms of the town-gown relationship, this is one of the most spectacular places I've ever been involved with. You go around the city and people meet you, find out you're working at Fralin Biomedical Research Institute or the Virginia Tech Carilion School of Medicine or Carilion Clinic, and they embrace you. They really embrace the mission. They embrace the enterprise. They're supportive in lots of different ways. One very concrete example is right now the city is working on a kind of what they call an innovation corridor, connecting the medical center area right to the downtown, just a matter of blocks, and building up a variety of things. And there's a building that we've gotten support from the state and the city government for an incubator, more of an accelerator facility for spin-off companies and researchers. So I think the whole community is really appreciated and seeing what this can do. And it's not just economic impact. That's extremely important. I agree completely with Heywood, but it's also just the life and vibrance and the culture of the city and all the people that are coming in and interacting. Our kids are in the schools, participating in volunteer organizations. Our faculty, staff, and students have embraced this community. It's home, and it's a great partnership.
Yeah, I've heard a lot of city council members make the comment that the future of the city and the surrounding region depends on the research institute.
That's great. If I can just ask you briefly, Dr. Friedlander, I want to get this one last one in. Could you talk about the types of resources that researchers need in terms of, she's asking core facilities or access to animals? I know you touched on that. They're patients. It's not.
Right. No, of course. So whoever asked that question hit right on one of the key things. You're attracting people, particularly to a new enterprise, to do world-class research in what is a very competitive environment, the best and the brightest. One of the things you have to have is the appropriate facilities. And of course, we do what every other major academic medical center in the United States does. We recruit people to get startup packages. You can, behind me, I can't put a quick dollar figure on all the stuff that's behind me here, but let's just say it's well into many millions of dollars that goes into the labs. But above and beyond that, you have to have these major facilities. I named a couple along the way, where each one might cost anywhere from $1 million to $10 million. Those aren't the kind of things we can afford to buy each researcher their own version of X or Y. So we set up these core facilities. The state, the Commonwealth, has been extremely supportive and generous to us in providing funding for those core facilities. In addition, of course, Virginia Tech and Carilion in the early days with the startup investments. So what we've done is really locate a number of those throughout our buildings. And when we're recruiting people, one of the first things they see is they have access to the very leading edge of virtually any technology you can imagine. Animals, of course, veterinary medicine, those are patients. We do a lot of work, as do most academic medical centers, what we call model systems. So those are often mice. Some of our investigators work with fish to do genetic studies. So we have to have very world-class leading edge vivarium facilities. We get great support and care for those from our veterinary school and our animal services people as well.
And I want to add one thing to that, Mike. The Commonwealth of Virginia, you noted, had been very supportive. The very first building that was built at this research institute was financed through a bond issue of the Commonwealth of Virginia for higher education. So the state has been really, really supportive.
Yeah.
Great. Thank you so much, Mr. Heywood Fralin, Dr. Michael Friedlander. It's been wonderful talking to you both from the inception of the Fralin Biomedical Institute to seeing the successes over the years and knowing where you're headed as well. So thank you for sharing with an even broader audience today. We really appreciate your time and your dedication. And thank you for talking to us. Sheila, I'll send it back to you.
You're very welcome. Thank you.
Thank you, Don. And thank you, Dr. Friedlander and Mr. Fralin. We really appreciate your remarks and congratulations on your awards.
Well, thank you for the award.
Thanks very much. Very honored.
One quick announcement before we end today's meeting. Our next Alliance discussion is Tuesday, December 20th at 2:30. And we're going to be talking with Eric Ewers and Christopher Lauren Ewers, who are co-directors of Hiding in Plain Sight Youth Mental Illness. And they are winners of the Research America 2023 Isidore Rosenfeld Award for Impact on Public Opinion. And there is going to be a link to register for this Alliance discussion in the chat right now. And thank you, everybody. And we really enjoyed the discussion. Take care.
Bye-bye.